The femur is the longest and strongest bone in the body. It is bowed anteriorly and laterally to allow for accommodation to stress placed on it during closed kinetic chain. When someone fractures their femur, we know that there's going to be something pretty vicious to cause a femur fracture. Generally speaking, your mechanism of injury is going to be a fall involving torsional stress, a direct blow to the area, or something similar, with the most common fracture site being the mid 1/3 of the shaft. When I had a football player with a femur fracture, I didn't believe it. He was laying on the field. I had to stop the play because the officials didn't even notice him laying on the field. I ran out to him. He grabbed my hands. I broke my femur. I broke my leg. I broke my leg. I broke my femur. And I just looked at him and said, "Chad, you didn't break your femur." However, when I went to straighten out his leg, I could feel it completely move as if it was jello, and I knew that something was wrong. Signs and symptoms are going to include, obviously, excruciating pain, deformity. The person may look like they have a shortened leg. There will be edema. The person will be dysfunctional, unable to ambulate, and there may be a quasi-midshaft joint if it is a displaced fracture. Special tests that could be done are your standard of practice fracture tests, such as a compression test. However, that is probably not the nicest thing to do on a person that has fractured their femur. If you suspect a femur fracture, you have to think about a couple of things. First of all, the person is probably going to go into shock. Again, this is the largest bone in the body, and their body is going to start shutting down because of that. You want to check the pulses. You want to check the dorsal pedis as well as the tibial pulse. These two pulses are going to come into play because if there is any type of displacement and pressure is placed on these arteries, we've got a big problem. You also will want to do a neurological assessment. Diagnosis is going to have to be via x-ray. Treatment-wise, you are going to need to triage the situation. You're going to treat that person for shock, and you're going to include tractional splinting for the bone. Surgically, there is going to be a rod that is put through the shaft of the femur.